This is chapter 46, video lecture part 2. In this lecture, we're going to continue to talk about impression materials and techniques. With elastomeric materials, some of our characteristics are going to include using when an accurate impression is essential. These materials are self-curing and they're supplied as a base and a catalyst. And they're always supplied together because we're going to always use them together. Forms of elastomeric compression materials are going to include our light-bodied material. This is also referred to as a syringe type or maybe a wash type. This can flow into and around the details of the prepared tooth. And then we have our regular and heavy-bodied material. These are a little bit thicker than our light-bodied material. We're going to use these materials to fill a tray and force that light-bodied material around the teeth for a more accurate, detailed impression. Basic impression technique: the dentist prepares the tooth or teeth for the impression. We'll use that light-bodied material. We're going to prep it and load it into the syringe and then transfer that to the dentist. The dentist then is going to place the light-bodied material over and around the prepped tooth or teeth and surrounding tissues. Our heavy body material is going to be prepared and loaded into the tray and then transferred to the dentist. When the impression material has reached its final set, the impression is then going to be removed and inspected for accuracy. The impression will then be disinfected. We're going to place that in a biohazard bag, label, and ready to send it to the laboratory for the laboratory technician. Some of the carrying stages in the elastomeric impressions material are going to include the initial set. So this is the first stage. It results in the stiffening of the paste without the appearance of elastic properties. Our final set is the second stage. This is going to be where we start to see the appearance of the elasticity and proceeds through a gradual change to a solid, more rubbery kind of mass. Our final cure is the last stage, and this is going to occur within 1 to 24 hours. Many different methods of mixing are available for the elastomeric impression materials. The most common sequence involves preparing the light-bodied material first and then the heavy-bodied. We also have a paste system, an auto mix system, mixing unit, and then also a putty. The types of elastomeric materials include a polysulfide. This is a rubber base. It has a relatively long working and setting time. We have our polyether. This is stiff and requires a thinner, which is included in the kit. Silicone is an odor-free, non-staining, relatively easy to mix material. And then we have our polysiloxane. This is a high dimensional stability. It has a low tear resistance and no taste or odor. Next, we'll talk about the occlusal or the bite registration. So this is going to be an accurate registration of the normal centric relationship of the maxillary and mandibular arch. We also refer to this as the bite registration. Polysiloxane bite registration paste is one of the most popular materials for our bite registration. It's very fast setting. We don't have any resistance to the biting forces, no odor or taste for the patient. This gains dimensional stability over time, and it's just very convenient for us to use. We can also do what's called a wax bite registration. This is used to show the occlusal relationship of the maxillary and mandibular teeth. It's particularly useful when we're doing diagnostic casts and need to trim. The most common techniques are just to use a little bit of softened base plate wax. The disadvantage here, though, is that we don't have that dimensional stability. Using ZOE as a bite registration paste, so this might be selected when a more durable material is needed for registration. The paste offers little to no resistance to bite closure. It's very fast setting. This is going to be supplied as a paste system. We would dispense it onto a paper pad, mix, and then place on a gauze tray for the patient to bite into. We're also seeing a lot of digital impressions. So these are replacing our traditional material based impressions. We use a laser or a light source to scan the teeth and surrounding tissues. This then generates a precise replica of the oral cavity without any of the unpleasant taste. We could do this with our digital photograph or a digital video. Advantages, to the digital impressions are that the patient's gonna be comfortable, better communication, and it gives the patients less anxiety. We have seen improved quality and better fit with our digital impressions. These are very quick and accurate. It aids surgery with accurate stents, and electronic storage of scans is efficient with our record keeping. The disadvantages are that we have a very, very high initial investment for the scanner, periodic software updates, and routine maintenance. Initial learning curve is steep, some discomfort for the patients who can't open wide enough for the digital scanner. Um, Records debris and saliva, and then also hanging margins on the teeth and in the oral cavity, and could require some additional staining.